I yield, and I recognize Mr. Courtney for 5 minutes.
Thank you, Madam Chairwoman. And again, Mr. Secretary, it's good to see you in the People's House, your real home in Washington. Again, I'd just like to begin my questions by noting the fact that your department and the Medicare Board of Trustees just issued its 2024 solvency report about a week ago, which was really nothing short of astonishing. In 2023, the trustees projected that Medicare would run into solvency issues in 2031. Again, a week ago, they pushed that out by 5 years to 2036. Again, that's partly because we have such a strong job market and stock market. The revenue that's coming into the program is much stronger than anyone expected. But also, the report noted that the Inflation Reduction Act is expected to lower Part B drug spending by about 9% starting in 2028. So again, you mentioned the price negotiation, which is, again, very much going to help patients. But this report suggests that this actually is going to address the question of Medicare solvency for not just seniors, but working age Americans and young people. Isn't that correct?
That's correct. The Inflation Reduction Act is working, just as you all thought it might.
So in your testimony, you noted that the 2025 budget included legislative proposals which, again, would use that drug negotiation authority to even further strengthen the Medicare trust fund. Again, I think the term was that it would basically, make it solvent for the
for our
long-term
lifetimes,
future.
beyond our lifetimes.
Can you talk about that a little bit? Because I really think that is something that, for people who really question the solvency of these programs, is a really profound statement.
Yeah, it's not rocket science. You just have to be willing to invest your dollars in your savings that you incur from having better programs in healthcare back into the healthcare system. And so, as a result of what President Biden is proposing with the legislation you all passed to help us negotiate down the prices of prescription drugs, you pump that money back into the system, and guess what? Now you've guaranteed the strength of the Medicare system beyond our lifetimes.
So Mr. Scott, along with his colleagues on the Energy and Commerce Committee and the Ways and Means Committee, introduced a measure, the Lowering Drug Costs for American Families Act, which again would take the benefits of that price negotiation and actually make it available to the rest of the country in terms of employer-based plans or individual market plans. And again, that was in the bill when we passed the measure in the House, and unfortunately didn't make it through the Senate. But again, can you sort of talk about, again, the department's perspective on this? Because really this is about lowering drug costs for everyone.
Congressman, as you recall from the President's State of the Union address, he's right where you are, where Congressman Scott is. He would like to see the benefits that we see for Medicare recipients and lower drug costs expanded to include every American. There's no reason why only Americans who are in the Medicare program should get $35 or less insulin. Why shouldn't every American get it? And so he is very supportive of this effort to expand access to more affordable prescription drugs to all Americans.
So one other sort of ripple effect of, again, the department's work in terms of prescription drugs is that some of the drug manufacturers have almost kind of been shamed into announcing that they want to actually lower the price of insulin and inhalers, for Americans. So again, I mean, I think it's creating a virtuous sort of, environment where, again, it's encouraging and realizing that for people who sell into this market, they really, it's not sustainable to overcharge people based on their age. And again, can you talk about, again, that, again, really non-mandatory but still beneficial impact of the Inflation Reduction Act?
Well, once again, when you make it so that the drug companies have to actually negotiate on prices versus just dictate to the American people what the American people must pay, you inject a little competition, and guess what? You get to lower prices. I keep telling folks that competition is as American as apple pie. What we're doing in the prescription drug space is saying, companies, let's negotiate, get the best price, because we have a right to be competitive for the seniors on Medicare and for every American to get good prices, so we're not paying 2 or 3 times the price for medication here in the U.S. Above what others pay around the world.
As someone who suffers from seasonal allergies, I was really excited about the inhaler development. So again, thank you for your great work. And again, lowering costs for Americans. I yield back.
Gentleman yields back, and I recognize the gentleman from Pennsylvania, Mr. Thompson.
Thank you, Mr. Chairman. Mr. Secretary, it's good to see you. As you may know, I spent nearly 3 decades in healthcare as a therapist.